Naturally, hospitals are bracing for an increase in COVID-19 admissions. The infection rate has climbed to 116 so far, with Gauteng the new epicentre. Hospitals are running out of test kits, we are told. There's also been an increase in person-to-person transmissions, that is locally, people with no history of travel abroad. ENCA's Kaeli Kumalo joins me now for an update on the media briefing that came through from the Gauteng provincial government, talking about their readiness to respond to the COVID-19 situation. And so, Kaya, part of what has been encouraged is ramping up issues around hygiene, taking care of yourself. But it seems the Gauteng provincial government now taking it a step further. This is a virus that is flu-like in its manifestation, and part of the measures will include responding in that regard.
Well, absolutely, Tula Caesar. So the economic hub really is facing a massive challenge, but of course an assurance from authorities in the province that they're working so hard in making sure that they contain the pandemic. But of course the numbers thus far are really massive. I mean, you have about 45 cases. So we just spoke to the MEC for Health in the province, Dr. Masuga, and he said luckily for now, so in terms of the diagnosis for the patients that we've had, it's been a very mild infection, so we haven't seen any worst case so far. And throughout the day, Tula Caesar, we have been crisscrossing some healthcare facilities that have been designated to treat patients. Unfortunately, we're not able to gain access for a number of reasons, just to make sure that the healthcare workers are given more space to really make sure that they deal with these cases. So, Tula Caesar, let's take a listen to the MEC really reaffirming how they're going to try and make sure that, for example, the vaccination is one of the key areas that they'll be working on.
We're going to make sure that we give almost everyone, starting with the most vulnerable, flu vaccination, so that at least we're able to cover that base and get what we call herd immunity, to make sure that most people get immunized and vaccinated against common flu. Then when we have somebody with symptoms, then we know that it's something that we might need to take serious, and if it comes with positive responses on the screening questions, it makes it easier for anyone to follow it in terms of the medical patient. So our elderly population will be duly be vaccinated, our pregnant women will be duly be vaccinated, and the children will be duly be vaccinated. We're going to start with the most vulnerable group, and we are procuring more stock in terms of flu vaccination.
Dr. Bandile Masugu, the MEC of Health here in Gauteng. Important to emphasize that he is talking there about the vaccination for the common flu and not necessarily a COVID-19 vaccine. Having said that, the work is going on in other countries to try and get us to that particular point of a specific vaccine for COVID-19. Kaya, talk to me about the readiness by way of facilities. There was talk about issues, for instance, around bed space. What are those interventions around bed space in public hospitals in Gauteng, but also then issues around some of the procedures, whether they'll be carried out or not?
That's right, Tula Caesar. So the government is fully aware of the constraints that they have given the infrastructure and the very overburdened healthcare system that we have. So now they've increased the number of bedding, and we know that in Gauteng alone there are 3 facilities that have been earmarked to treat the patients. So now they've increased the beds to like 200 odd. So the MEC really emphasizing also the issue of saying from their side they will continue to appeal as well to the private sector to play a very critical role, given the fact that these are very uncertain times and the country is really all hands on deck in making sure that we're able to tackle this. So let's take a listen to him once again, elaborating further.
We are going to circulate a circular that will actually outline that we are downscaling our services in terms of outpatient and elective measure. So outpatient is those people who are coming for checkups and so on, and those who are awaiting elective operations. will be put in abeyance for almost a month. But it will depend on how we respond. And we're also procuring more test kits, which will make it easier for us to rapidly get results in terms of the detecting and diagnosing the infection. These measures will also just work in terms of us helping us to get outside the issue of containment.
Thank you for that, Khayelihle Khumalo.